So I would like to tell you a little story, and it's about these two boys. So we have Tom on the right, and statistics tell us that Tom will go to college, he will graduate, he will get a great job. Hopefully, he'll meet the love of his life. They will buy a house, pay the mortgage, raise a family. He will work till he's about 65, retire. He'll live well into his 80s, so he will spend the rest of his time with family and friends. The odds are in his favor. For Shola on the left, the story is quite different. First of all, he's lucky to even be alive in a country where for every 1,000 births, 68 children do not make it. He's a lucky survivor, but he will also have to conquer malaria, a host of infectious diseases, and maybe malnutrition to make sure that he does not become one of the children who do not survive their first year. Nigeria, according to a UNICEF 2018 report, is currently the 11th most dangerous place to be born in the world. If Shola is lucky, he will live to the ripe old age of 55. It doesn't sound very fair, but the life expectancy for Shola is 53.7 years.
And around the world, women typically get 6 years more than men. But that's not the case in Nigeria. In Nigeria, they'll be lucky to get 3 more years. And that's if they don't die at childbirth. Nigeria presently has one of the worst indices in maternal mortality, with more than 800 women dying per 100,000 live births. And that's not even all. At every given time, there are only 5 hospital beds available for every 100,000 Nigerian. And that's one of the reasons why 5,000 people travel out of Nigeria to seek healthcare on a monthly basis. We've all seen or received something on Twitter about GoFundMe or something like that. Depending on who you ask and when you ask, there's usually a health insurance coverage of 0.9 to 5.1%. And there are 3.2 million Nigerians living with HIV, but only 30, give or take, have access to ARVs.
So one of the questions that you would want to find out is how much is Nigeria spending on healthcare? And, well, here you can see a list of some countries, but I think it's important to note, as Dr. Ola already said, that we are spending about 5% of our GDP, so that's all the money we get, on health. And that is one of the easiest ways to assess how committed a country is to spending on health. Now, I would like to let you know that in 2001, African Union member states met in Abuja, and they agreed that they would implement at least 15% spending on healthcare of their GDP. Since 2001, only 5 countries have been able to attain that level of spending. Nigeria is not one of them. In fact, we are ranked 52nd of about 55 African countries when it comes to spending on health.
So, like was said earlier, the health spend per capita, basically this is how much the government allocates based on the budget and the population on each individual, on individual people in Nigeria, or individual person rather, in Nigeria, is about $79. Basically 25,000 naira per year. And again, the health insurance coverage is still really poor, and that leads to about 70% of the total healthcare expenditure in Nigeria to be out of pocket. According to a WHO report in 2018, about 1 in every 10 medical products in Nigeria is substandard. And this is particularly bad because we know that a huge number of Nigerians either don't have the means or the ability or willingness, rather, to visit hospitals. So they tend to go to these vendors, and that's where most of these drugs are available at.
So, death is inevitable. What is unacceptable is the large number of avoidable deaths that we are learning to accept as part of our lives. 1 in 5 Nigerian children will not live to see their 5th birthday. We are quickly becoming a nation of people who are being born just to die. So we might have a problem, I think. So it would be an overly simplistic view to assume that our poor health indices in Nigeria is because one, we're a large country, two, we have a relatively poor economy, Dr. Ella explained that to us, and three, we're scrimping on health spending. And I will give two examples. So there's India. They have a far larger population. They end up spending less because of the number of people per capita. But we know that India is one of the top locations for Nigerians to travel for medical tourism. On the other hand, there's the US, and they spend a lot. They spend almost twice the amount that the UK and Germany spend on healthcare per capita, so that's per person. But they still have worse scenarios or outcomes in certain cases. These two scenarios help make it obvious that throwing money at the problem isn't the solution. So developing a system that works for your country is. And I like this quote, which is why it's here. And it says, the challenge to Nigerian innovators and game changers in the healthcare space is to find ways to do more with less. This will be done by using technology to leapfrog over now obsolete ways of delivering healthcare and go straight to modern tech-enabled fixes. This is by Dr. Brown, and this is why we're here, health tech space. Okay, so the report identified 75 active startups, and they've been able to raise a little under $8 million in the 14 years that the sector has existed. Now, those 75 startups exist in 12 subsectors, which are diagnostics, elderly care, electronic medical records or health information systems, hardware and infrastructure, health logistics, health insurance, maternal health, mental health, pharmaceuticals, public health. We have telemedicine and training.
So at the launch timeline, in 2004, the first identified health tech startup was started, and this was AppMis. And it took a couple of years before the second one was launched in 2012, although now defunct. And following that period, there's been a steady and organic growth of startups that have been launched. 2016 until date have shown a significant increase in numbers, and they contain most of the startups that have been launched in that period. Well, it's not surprising that almost 60% of the funders in this space have a health or a biological science background, and then we have others with engineering or IT background.
55 of the 75 active startups that we uncovered are based in Lagos. And I would say that this overconcentration can be accounted for the financial burden and the logistical difficulties of setting up a tech-based operation in remote areas. Now, these remote areas would benefit most from tech solutions because they already have the existing problem of poor access to facilities and healthcare providers. It's a bit ironic that the people who need these solutions the most are currently the underserved. However, it's important to note that 70% of the startups, as at the time of the report, are servicing clientele outside of their physical location in at least one state. Okay, so this picture I like a lot is an example of how we hope tech will be utilized here soon. A zip line is delivering blood to hospitals in remote areas that would take a long time to access by road or places where they're not even accessible by road.
All right, so to funding. In 2017, fintech raised 6 times more what health tech was able to raise rather. And this is both locally and from a continental standpoint. Well more than 50% of the funding were grants. However, in terms of raw cash, VC funded deals were fewer, but more money was raised in those deals. These are the top funders in the space, and we can see that they are international funders. So there's a need and I think urgency for more local funders. YC, Facebook, Merck, and Google. However, there are some notable local funders: CC Hub, Tony Elumelu Foundation, Private Sector Health Alliance of Nigeria, Venture Platform, and She Leads Africa, However, most of them still deal within the grants trade.
So, there's a general low representation of women in tech. And when you look at the founding groups for Nigeria's health tech startups, that is evident. You have 70% of these founding teams as all male groups, and the remaining 30% is split as mixed groups, so with men and women, or all female groups. Now, there is also no empirical evidence that mixed teams have it easy or easier raising funds, but mixed teams are responsible for raising 50% of the total amounts raised in health tech sector till date. So that makes them the most funded group as of now.
So, talking about funding, we want to break it down into subsectors. What subsectors have been able to raise more money? The EMR subsector is still the most or the best funded subsector so far, but it's a bit skewed. Not even a bit, it's actually quite skewed, because one of the startups there has been able to raise well over $2 million. So, Helium Health. So, that kind of makes things a bit skewed. Second is pharma. Pharma hasn't raised as much money as EMR, but they've been able to spread that money across more startups. So they've funded more, they've got more startups in that subsector funded than in EMR, excuse me. And then the third is health insurance. Although this is a bit estimated, Reliance HMO has been able to, we assume, has been able to raise well over $1 million on account of the fact that most startups that make it to YC tend to raise in that region. So we estimate that they've raised at least $1 million.
So the healthcare sector is highly regulated. It's not much different for health tech. It's highly regulated, requires a lot of public funding, infrastructure, and support. Entrepreneurs are definitely careful of this regulation while they're operating. However, they're still winging it because...
Well, as it is, there's no national health policy document, right? But to be fair, agencies like NIDA, Ministry of Health, Ministry of Communications, have been engaging entrepreneurs to develop a policy document. But until that is done and crystallized, most entrepreneurs are still basically just working within a very opaque framework. Yes, some of the initiatives and partnerships that have been happening within the sector. My favorite, and which I think is a perfect example of PPPs in health tech, is when CCHub and NIMA, the Nigerian Institute of Medical Research, piloted and released NIMCare, which is a digital patient tool that encourages and promotes adherence to the treatment of TB. NCDC as well is one of the Nigerian parastatals, and they've been able to use technology as a means to disseminate information and get feedback from general public. So some other initiatives and meetings has been held by Digital Health Nigeria, Impact Hub, and EpiAfrique, where they organize hackathons, they organize meetups, which eventually I think might lead to a higher number of partnerships and collaborations, which will lead to the growth of the sector.
The health tech sector, like any other, has its challenges. These are a few. So standardization. As there's no particular blueprint, everyone seems to be doing their thing. And that would be an issue when it's time to scale, because I have my interpretation, you have yours. You can imagine what that does. Then there's a limited supply chain system. For now, a lot of the supply chain is focused on big cities, for example, like Lagos. And you need to service other areas, especially when you're thinking about pharmaceuticals and like medical products. Getting these things to the remote areas needs a lot of help. Now, Wale has done a good job of telling us a bit about what's going on in terms of funding, but health tech entrepreneurs could always use a lot more funding. It's going to take money to get to where we want to get. There's also the shortage of locally available talent. You need people who are world-class standard, who are willing to live in the madness that is Nigeria. So we should look into training more people who are already here and open to staying here. Now, there's the challenge of cultural perceptions about healthcare and accessing this care. Most people are not open to the new changes that are coming with health tech, like imagine telemedicine. People may not be accepting that just because of a perception that already exists and needs to be corrected. Also, people present very late at the hospital, most times because they don't have money, but all these things have become like culturally imbibed. Now, of course, where there are challenges, there are opportunities. It depends on how you look at it. There's opportunity for medical savings, and I would like to highlight the collaboration between Piggy Bank and Avon Health, HMO, from October 2018, which is supposed to encourage the average Nigerian to save as little as they possibly can towards their health. There's a lot more space for players to come into this. Then there's hardware solutions. Health tech entrepreneurs are having a difficult time simply because the hardware is not locally available. It's expensive, and if there were people handling that, it would free them up to be able to focus on what they actually need to do and not just getting the things they need to get started. So there's also, like all over the world, there's been talk about improving patient care, which is fantastic. I think that there's an opportunity to focus on health workers and their experience. So if that's tackled, we believe that that would actually help improve the general level of care and also the patient experience.
And on the account of the low or poor penetration of health insurance in Nigeria, we believe tech can play a significant role in the enrollment of more people into health insurance, and also support the federal and the state insurance schemes through tech. A public healthcare complaints database will be really good at this point, and I think the information and data that's received from that would influence some of our politicians and even provide data for some of the entrepreneurs themselves. Healthcare education is also a place that I think there's a lot of opportunity, either to educate the healthcare workers themselves or to educate the clients and the general public. In conclusion, here are some of the recommendations that we have. Capital is rare, and we would like more capital in the space, however way possible, preferably VC money or angel. And women are still well underrepresented in tech in general, but also particularly in health tech. There are still less women playing in this space, and would encourage more women to get in. Presently, there's something that looks like an EMR startups arms race. So everybody's just biting whatever part of the market that they can bite. And we think that this is fine at the moment, but at the point where there's a need to scale, there might be a problem because of the poor interconnectivity and interoperability, excuse me. And we believe some form of mergers and acquisitions will be nice. Also, we recommend that startups start to engage regulators proactively, because it's best that way when you go and you have a list of recommendations to the government, rather than when the government comes with what, depending on whoever created that agenda. We also believe that, or we recommend that some startups start to provide full stack offerings rather than very specific corners of the market, because over time this might become obsolete. And then particularly for health insurance, we believe that retail insurance solutions should increase as the race to reach the bottom of the pyramid hits up. Thank you very much for listening.
Thank you for listening.
And I hope you enjoy the rest of the